Hello, Samsung. Can you please off your camera?
Good evening, everybody. We will be joining in 5 minutes. We'll be starting the webinar. Kindly stay online. Thank you.
Recording in progress.
Good evening, everybody. Thank you for joining today's webinar on when to meet fertility expert. If you're planning to have children and you're seeking the support of fertility consultant, this is the right webinar for you to get the guidance from our expert, Dr. Amruta Rao. Amruta Rao Thota. She's a dedicated fertility consultant and gynecologist with specialized training in reproductive medicine and minimally invasive gynecology. She currently practices at Ankura Nilam Fertility Hyderabad, helping couples achieve their dream of parenthood through evidence-based fertility care. So she is well experienced, and Dr. Amrita Madam holds a fellowship in minimally invasive and laparoscopic gynecology from Kochi and is trained in advanced laparoscopic procedures and hysteroscopic for various gynecological conditions affecting fertility. So she Thank you very much for we have lot of information on our 9M Fertility website also. But today's webinar is especially for taking through you to the journey, like how to approach the fertility consultant and when to approach and what are the things to be followed. And Dr. Amrita Madam will be taking us through this webinar session. I welcome Dr. Amrita Madam to take over the session. Thank you very much, ma'am. Yeah, you can start the session now.
Can you see my screen, Sarah? Hello?
Yes, your screen is not screen. I can see. I can't see your video.
Okay.
Your screen is visible. First slide.
Or should I start the slideshow? Sarah, should I start?
Please on your video and start, ma'am. Your video is not visible.
Yeah.
Perfect. Yes, ma'am. You can start.
Yeah. Thank you so much. I'm glad to be introduced myself as Dr. Amrita. So I work at as a fertility consultant at 9M Fertility at Gachibowli. So today's topic is when to meet a fertility expert. Let us see. I'll probably make you go through what is the modern guide to understand fertility. How do you recognize the signs, and probably taking action together. So moving forward, let us understand what is normal first. So, in every woman, when the menstruation starts, like when the cycle starts, from a cohort of, the eggs, what is developed, one follicle, like one egg starts growing, it ovulates, and later, which will give rise to an egg for the sperm to meet. Now, we have to understand this window that sperm can live for like at least 5 days in the female reproductive tract, but the egg is viable for only 24 hours after the ovulation. This gives us a window of at least 6 days for conception in each cycle. After understanding the 6-day fertile window, so what are the odds of conception you find is like in a couple who is quite normal, In 1 month, 30% of the couples could conceive. At 3 months, 60% of the couples would conceive if everything is normal. And at 1 year, 85 to 90% of the couples would conceive. Now, conception will definitely require perfect alignment of the timing, and terrain. And when any variability is seen in any of these three, like, the timeline, like, when the ovarian reserve is deranged, like, when you're too old or, beyond 35 years, or when the age factor plays a role, probably the egg quality would it would be disturbed. And the timing also, when you had been trying in those 6-day fertile window, considering the fact that egg has only 24-hour window and the sperm has only 72 to 5 days. And the clinical health, like, the anatomical path, like the tubes are fine, the hormones and uterine environment, everything is fine. So all you need is all these three. And if you've been trying for 12 months, in spite of having all these three perfect, probably it's when you have to meet a fertility consultant, because you need to either alter any of these three, or you have to address these issues. Now, let us understand what is infertility, because first you have to establish a baseline before to know when to consult a fertility specialist. So the baseline is, if you had been not getting pregnant after regular unprotected intercourse for at least 12 months if you are less than 35 years of age, or at least for 6 months if you're more than 35 years of age, it is then when you are termed as an infertile couple, or when you're not able to become pregnant. It is at this time where you have to approach a fertility consultant. So, and you are definitely not alone in this path. Definitely, like you, 10 to 15% of the couples do experience infertility. Having said this, it is not always a female factor to be responsible. It is always an equation. Like, if we go through what are the main causes of infertility, we see that 25% of the cases are due to female health issues, 25% is contributed by the male, and both of them do share at least about 25% of the cases. And of course, like, 25% of them are unexplained. So definitely this means that infertility is not exclusively a female burden. 50% of definitely those identifiable causes does involve a male partner. So it is quite important that you as a couple have to take part in the investigation and meeting the fertility expert. Now, after considering the fact that the infertility, you have to check your age. That should be your first checkpoint. As we know, the female is born with a finite number of eggs. Like, when she's born itself, she is born with like 1 to 2 million eggs. And these eggs gradually they undergo, like, around in early 30s or something, like gradual and natural decline of ovarian reserve begins. You will be left with almost, like, by the puberty itself, you'll be left with only 4 lakh eggs. And by 30s, it will definitely steeply downward. At the age 35, the decline in egg number and the quality accelerates very quickly. So
Ma'am,
this will
slides are
be
not changing, ma'am. Slides are not changing. Only first slide it is.
okay. Now, Sarah,
Yes, yes,
I've put in slideshow. Should I now?
yes, visible now. Now it is visible.
Okay. So yes, as we discussed, this is the normal ovarian cycle that takes place in the woman. Like, every time, I'm just starting briefing it again, Sarah. Is that okay?
Yeah, fine, ma'am.
Yeah.
The previous slide also.
Yeah. So yeah, today we are talking about what is the modern guide to understanding fertility, what signs have to be recognized before meeting the fertility specialist, and definitely the action to be taken together, you as a patient and also we as experts, where we have to give you guidance in taking your path forward. So let us understand what are the normal things first. So, in a female, like in every cycle, there is one follicle which gradually grows and ovulates, and which ovulates the actual egg for the sperm to meet and create a pregnancy. So at this point, we are left with, in every natural cycle, like, there is a 6-day window, which is a fertile window. because sperms usually survive for at least 5 days in a female reproductive tract, but egg is viable only for 24 hours after ovulation. This gives us an opportunity of 6 days window for the conception in each cycle. So with this, targeting six day window in every cycle. So if a couple tries, it is believed that the timeline for a natural pregnancy is 30% of the couples usually get conceived within 1 month, 60% do conceive in 3 months, and 85 to 90% of the couples achieve pregnancy in 1 year if this fertile window is targeted. Now, with this, we come to a reality that yes, the timing, and the terrain have to be really good for a natural conception to happen. And all this have to be perfectly aligned. So, if any derangement of this time or timing or terrain happens, yes, at this moment, you have to meet the fertility consultant. The time meaning, yes, the healthy ovarian reserve, that is the egg quality, where the female age plays an important factor. The timing also, if you're able to time your when you're planning fertility, you're planning pregnancy, the fertile window have to be known, because as we know, the egg stays for 24 hours and the sperm stays for just 5 days. So ideally, if you take the fertile window, it is 5 days prior to the ovulation, and 1 day next to the ovulation is the fertile window you have in every cycle. And the terrain, where the anatomical path means the uterus have to be healthy, the tubes have to be healthy, your hormonal environment, everything have to be healthy for a good pregnancy to happen. So if you had been trying for 12 months like this with good timing and terrain, it is when you don't see your pregnancy at that time, yes, you'll have to go to a fertility specialist to identify which pillar needs the support. And before that, we need to establish a baseline. Like, we have to know what is infertility and when, because some couples do come very early for evaluation, and some couples do wait for months together, uh, hoping that a natural pregnancy would happen. So first, let us establish a baseline. So infertility is usually termed if you're not getting pregnant after regular unprotected intercourse for at least 12 months if you're less than 35 years of age, or 6 months if it is more than 35 years of age. So, having considered this definition, yes, there are still 10 to 15% of the couples who experience infertility, and definitely you are not alone on this path. So, with this, it's not always the female who takes the burden, it is a shared equation. Definitely, the male factor also comes into play, because we see the health issues 25% is contributed by the female health, 25% by the male health, and 25% is shared by both the partners. And obviously, we have at least 25% of it being unexplained. So, definitely, as told earlier, it is not exclusively a female burden. 55% is all 50% is always a male partner involved. Now, before meeting a fertility, if you have doubts like when to meet a fertility expert and all, your time and the age is your first checkpoint. Here we know the female is born with a finite number of eggs in a, because whatever eggs have to be released in her lifetime, she will be born with it. A woman will be born with it. So at birth, you will be born with millions of eggs, like about 6 to 7 millions of eggs. By the time you hit puberty, probably it comes down to around 4 lakhs. And by early 30s, definitely there is a gradual and natural decline of ovarian reserve begins. And by age 35, yes, there is a steep decline. And this is where your clinical alert, it's an inflection point, because 1 in 3 couples, it is seen that at this age, like around the age of 35, will experience problems in getting pregnant. And also in later life, definitely when the eggs, you will be left with minimal reserve of eggs, which might have increased risk of chromosomal abnormalities, miscarriages, and pregnancy complications as well. So understanding this timeline, next you have to understand the chance of pregnancy per cycle. When you're younger at age, when you are at 30 years of age, it is 20%. And when you, as you grow, like as it increases, as the age increases, beyond 40, it is comes down to like 5%, and beyond 45, it is less than 1%. Simultaneously, the risk of miscarriage also increases as the age increases, because we know that the egg quality and the reserve usually decreases beyond 35 years of age. Now, so this comes to an conclusion that when you're under 35 years of age, always seek help when you're tried after 12 months. And at 35 years, beyond 35 years of age, you have to seek help after 6 months of trying. And at age 40, yes, you have to see the specialist immediately. Now, it is already told that yes, the egg reserve is the female is born with a finite number of eggs, like you could see at the left hand side, where as and when like in every month a group of eggs get recruited and slowly they get they get atresia. And whereas the sperm side, like in male factor, like as you could see the tab, there's a continuous production of sperms, like as the tap flows everything, there's a continuous production of sperms. And what about the impact of male age is that yes, male age also impacts fertility, because though the counts, the motility, everything would be fine at any point of time during a male age, probably the DNA, there's something called as DNA fragmentation index that might be affected as the age increases in N also. So the other important thing is you have to listen to your body. What are the key physical signs that might have to alert you to see the fertility specialist early? Yes, you have to check at your cycle. If you have irregular cycles, like having no period for months together, or you have unpredictable cycles, or you have excessive bleeding, like soaking a pad per hour, or experiencing large clots, probably you have to, this cycle irregularities might suggest some ovulation disorders or some deranged hormonal environment. And also, if you have a severe pelvic pain or severe cramps or pain during intercourse, this might suggest certain diseases like endometriosis, fibroids, or cysts. So also these have to alert you to go early to the fertility specialist. Similarly, in the male also, if the males are having like trouble maintaining an erection, or they have low libido or any testicular pain or swelling, they also have to meet an andrologist as soon as possible. Irrespective, all these signs are irrespective of age, you'll have to go and meet the fertility expert and get it cleared. Also, if you had chronic conditions like diabetes, hypertension, thyroid disease, or if you had a history of cancer or chemotherapy, definitely it's a good way, like, it's a good thing to go and meet a fertility specialist and to know how to plan a pregnancy and how to move forward. Now, the fourth thing is the personal risk factors you have. So that could be, yes, as discussed, if if you are a known case of a PCO, or you have endometriosis, if there is a hypothyroidism, you're using thyroid medicines for a long time, or if you have diabetes or you have past cancer treatment, definitely you'll have to visit a fertility specialist early. And also, not only that, a family history of early menopause in either mother or sister before the age of 51, or if you had any previous ovarian surgery, because if you had any previous ovarian surgery, probably there could be loss of ovarian reserve also. At that time also, you will have to meet the fertility specialist. And any shared risks, like any history of cigarette smoking, both in men or women, and also any exposure to the chemotherapy or cancer radiation, or exposure to toxic chemicals also, would ideally will help you, like meeting a fertility consultant would help you plan pregnancy, and what are your prospects in future would be understood. So also there are a set of patients who had experienced 2 or more pregnancy losses. Them also, it's better in spite, like probably we could uncover, if you meet a specialist, you could uncover something else, like not just the common ones, why the pregnancies were happening, like the problem of conception is not it's not a problem for them, the conception, probably the pregnancy moving forward would be a problem for them. So in that way, if you could meet the fertility specialist or any expert, you could uncover certain facts like chromosomal disorders, or probably you could have like uterine fibroids or other abnormalities in the uterus, or some untreated thyroid disorders, diabetes, or some clotting problems also could affect the problems in having multiple miscarriages. And so having come to like what are the signs, what are the indicators to meet the fertility specialist early, what would happen once you meet, what you expect next is like you would have a consultation with detailed review of your health, lifestyle, everything, your history would be taken in detail, and probably a prior testing, like a simple testing of your ovarian reserve, the semen analysis, any imaging, basic imaging would be advised to find out the cause. And with that you would have a personalized plan, because it's not like one treatment fits all. Every patient is different, every condition is different, every couple is also different, so a treatment plan will be formulated according to you and your partner. So, based on the fact that like all this, how the pregnancy naturally occurs at various levels, the testing would be provided in that way. Like the egg has to be ovulated, it have to be picked up by the tube. There, the fertilization occurs, and then once the embryo is formed, it gets implanted in the uterus. For all these factors, checking all these factors, these are the various tests that would help to evaluate the biological roadblocks. So the ovulation factor would be tested, the age, the like your probability of fertility at a certain age. When you visit the doctor, your age also would be taken into consideration, and your probability of pregnancy, what are your future prospects would be advised. The tubes, the male factor, and also structures like any uterine factor like a basic scan, and also any endometriosis or adhesion. If you had a previous history of endometriosis or severe pain in cycles, or anything unexplained, like when you are all the factors have been covered, and still the cause is unknown, probably we have to check for the peritoneal factor through a basic laparoscopy as well. So these could be the testings that could be advised, and with that, probably the treatments are usually three simple steps. Basically, if a low intervention such as the drugs, a simple drugs like ovulation induction drugs could be advised in case if there is an ovulation, just the ovulation disorder or unexplained infertility, or otherwise probably the step two like IUI, it's called a medium intervention. Probably if there were any mild male factor issues or cervical mucus problems, yes, IUI is advised. And when there are blocked tubes or severe male factor infertility at advanced stages and recurrent pregnancy losses, yes, IVF would be the ideal treatment. But otherwise, this is not like hard and fast rule. Definitely, every patient is different, every couple is different, and looking at everything on a holistic way, definitely the advice is formulated. So a bit about preservation strategies also. Yes, those women who are career oriented, who wanted to as we know that as the age increases, the egg quality and the numbers decrease. So women who are career oriented, or they wanted to freeze eggs and go ahead. Yes, fertility preservation like as oocyte freeze is a good strategy. And also this leaves us with a final this thing, like you have to understand the fact that fertility is a couple's issue, it's not just one partner's burden. So with that, you will have to have a timely action, like beating your biological age curve. Like if you adhere to the thresholds like beyond 35 years, if you're trying for 6 months, and if you're less than 35 years, if you're trying for 12 months, if you had tried for 12 months and there is no pregnancy, you should have a timely clinical action. And also, it's not like one partner testing, both have to be evaluated simultaneously. And managing your weight, having a healthy lifestyle like quitting smoking and limiting alcohol, and addressing underlying diseases like diabetes or hypothyroidism, everything. And also, it's not just the physical factors, definitely your mental resilience is also very important. Managing your relationship, managing stress, and with counseling and attaching to groups, definitely a successful conception is possible. So with this, definitely the specialist, meeting a specialist will provide an expert, it's a process where it will help you feel in control, because you will know what is the cause, when to, what is next, what is the next step, what you could do. if you still if there are some couples who still wait for natural pregnancy to happen even beyond like 40 years of age and everything, in that case, yes, the odds are very less for a natural conception. In that way, you wouldn't know, you're not in control of yourself. Definitely don't delay seeking help, and definitely early action will deliver better outcomes. So with that, we'll leave you with any questions. If anything else, I would be happy to answer.
Yeah, we have a question, ma'am. What are the most common causes of infertility in men and women?
Okay, so in men, mostly it is the ovulation disorders. So there are many factors like you have to check, like right from the ovulation, the tubes, the uterus. Basically, these three are the basic factors we have to check in the woman. The most common would be definitely ovulation disorders, because these days we keep seeing cases like PCOS, like endometriosis, everything which have they have trouble with ovulation. And in men, definitely there could be many causes, as the age increases, definitely, though the counts, motility, everything are fine, the DFI, I think, is the one factor where we are not actually uh, where the couple or where the public is neglecting, and it plays a very important factor in conception. Yes. Anything else, Sarah?
Yes, ma'am. Thank you. One more question we have. All my tests are normal and I am on ovulation induction, but still I am not conceiving. What could be the cause?
Yes, all your tests are common, and it's all normal. But ovulation induction, you'll have to check how many cycles you're going through the ovulation induction, because ideally, when you had tried ovulation induction, you'll have to understand the chances of pregnancy also. Usually, in an ovulation induction and a natural cycle, the chances of conception is just 8 to 10%. Like if you had tried with some IUI, probably the chances would improve a little, like 10 to 15%. But you have to understand the fact that beyond 3 cycles, the success rates usually plateau in an ovulation induction cycle. And because why it is 8 to 10%, because we are just blindly, when the time when the egg is trying to be released, when the egg is released, we are asking the couple to try naturally. But what is happening beyond is what is unknown, like whether the egg is really released or not, whether the quality of the egg is good or not, is all it cannot be determined by simple tests. in, so whether it is picked up by the tube or whether the sperm had really swimmed up to the egg and fertilized is what we don't know. So that's why probably if your ovulation induction you had tried for 3 cycles of natural, it's probably better, and it's ideal, it's to move towards IUI.
The same person has also messaged that even 3 cycles completed and IUS also failed. Then what would be the next step they're asking?
So even if the IUIs have been failed, probably if you had tried 3 cycles of IUI, there's something more you have to look into. Probably there's something unexplained. Since you said there are many, all the tests have been normal, there are certain, like as I said, IUI is also like 10 to 15% success rate, because when 100 couples are going for like IUI process in a month, there is only like 10 to 15 couples who would get positive. Rest all, definitely they wouldn't end up in a healthy pregnancy. Why? Because definitely in IUI, what we are doing is we are placing sperms close to the ovulated egg. But what is happening beyond is also we don't know. So ideal option, if you had failed multiple cycles of natural drying and IUI, definitely the option of IVF is always better, because in IVF, what we do is we take out the egg and we check under the microscope to see if the quality of the egg is good or not. And similarly, you're bypassing certain things, like where we are leaving the sperm and egg to meet naturally. Here, what we do is we do something called as ICSI, where the egg and the sperm are injected directly in laboratory, and the embryos are grown, and hence we are preparing the the uterus, and we are placing the embryo in the next cycle. So probably the odds of pregnancy will definitely increase in IVF.
We have one more question, ma'am. When do you recommend treatments like IUI or IVF? And what is the success rate of IVF in different age groups? Is it painful or risky?
Okay, so the success rates of IUI is definitely 10 to 15% when all your, like, when you had ovulated at least two good eggs, two or three good eggs, and when the sperm count and motility is everything fine, your tubes are open and your uterus is fine without any fibroids or polyps, the success rate is only 10 to 15%, as I said, because what we are doing is we are blindly depositing sperms into the uterus, and what is happening beyond is what we really don't know. In IVF, the success rates is like when you had formed good embryos, like if you had placed a good day 5 embryo, definitely the success rate would be ranging between 40 to 50%. If you're placing two embryos, it is 60%.
And when do you recommend treatments like IUI and IVF, ma'am?
Yeah, IUI, we check like your age factor, your married life. See, this is a holistic picture we have to take. So, if you're young, your reserve is really good, and I mean, the male factor side is also really good, and the tubes are open. Basically, the tubes are also normal. Yes, we can go for IUI. At least if you're within 35 years of age, you can still try for 3 cycles of IUI. And IVF, yes, you had a blocked tubes, like the reserve is quite less, where you really can't lose your eggs in simple treatments like IUI, because when the reserve is less, probably the quality, if your I mean your quality of egg also might decrease. At that time, to utilize the eggs in a better way, definitely we suggest for IVF. And also when there is a severe male factor infertility, like when the sperms are less than, like the count is less than 10 million, 5 million, it is ideal to go for IVF. Sarah?
Really great, ma'am. That's really great. One more question we have. Having first child without any issues naturally, what could be the reason for the second childbirth
Sorry,
delay?
Sarah, I didn't get you.
They mean to say that first child they had without any issues naturally, but what could be the reason for not having a second childbirth, like delay in the childbirth? Yeah, reason.
So this we call it as secondary infertility. So if you had a conception earlier without any like it had been really easy, like naturally conceived with everything. So as you age, like we have to check your age again. We have to get you have to evaluate like whether the tubes are fine, the male factor, because the count sometimes with infections and all, the male counts also vary, and also sometimes your age have to be checked, your reserve have to be checked, probably that those could be the reasons why your second child has been delayed. So we have to evaluate properly before, like when still if there is no factor involved, like it is unknown, like every test has been coming normal, in spite of having, like having a first child, having the test being normal, yes, you can try for simple treatments, at least, like when you're in the good age group and all, yes, you can try for simple treatments and take call.
Thank you, ma'am. Uh, any more questions? If you have anybody, please kindly drop in the chat bot, and Dr. Amrita madam would be answering that. Or else we will be closing this session shortly. I hope all the questions are answered. Uh, So thank you so much, ma'am. I think we will close the session, and thank you so much for explaining in detail about the when to see a fertility consultant and what are the causes for the infertility issues in men and women, and how does it really impact both male and male factor and female factor impacting the fertility journey. That's really awesome, and thank you so much, our audience, for joining the webinar. And we are coming up with much more very important topics in the month of April. Kindly stay tuned to our Facebook and Instagram pages and do follow us, and keep yourself equipped with a lot of knowledge about the fertility. Thank you so much, ma'am. Thank you.
Thank you for having me, Sarah. Thank you so much. Thank you.